NFL player Demar Hamlin collapsed from cardiac arrest during a Monday night football game earlier this month. CPR is an emergency life-saving procedure that's performed when the heart stops beating. Doctors say CPR saved Demar's life. It's now brought to light just how vital CPR and first aid care is. Joining us now is Dr. Junaid, who is a cardiothoracic surgeon at Sutter Health, and Dana Cooper, who is a nurse, and she's going to demonstrate for us in just a moment the two different types of CPR you can do, the manual CPR and the CPR you can do with the device you see over there. Dr. Khan, thank you so much for joining us. Right now, we saw what happened to Demar Hamlin, but this is happening a lot in youth as well, and that's the scary part. And there's a very specific reason why we see a lot more of this happening in youth. Talk to us a bit about that.
Yeah, Andre, I think that's exactly right. I think, everybody got excited when they saw this on Monday Night Football, but really we've actually seen this event occur on youth sports fields, baseball, soccer, lacrosse, and in the stands. So the reason Mr. Hamlin did well after it is because he got CPR right away. That is the key message for parents and people who are watching, is to go to the American Heart Association website and learn CPR.
And we're talking about young teenagers specifically because they have a lot of contact sports when they're in high school, and they're more prone to having issues. Contrary to what maybe people believe, people think maybe some older people may have this issue more often, but you're seeing issues in sports. Talk to us a little bit about that.
Yeah, the condition is called commotion cardio, which is just people don't have a big heart attack. Is when there's sun impact, it causes an irregular rhythm.
Right.
And when that occurs, the heart stops beating and blood flow to the brain stops.
And that's why you're encouraging the facilities, schools to have AEDs on site.
Exactly. I think that's important. The Heart Association, we got the AEDs into the airports. We have them in sports fields. Parents need to know where the AED is at their sports field.
Yeah, I know. I was walking out the elevator. We have one right by the elevator right here on the second floor, and then we have one right downstairs in our newsroom as well. And that's because I actually witnessed someone having a heart attack and looked around in the hotel a few years ago, and I could not find the AED because I don't know how to do CPR. But that's why we want to talk to Dana now. You do have these two different options, Dana. If you want to step up here for a moment and show us a little bit. You have the two different forms here of CPR. Talk to us a bit about which one this is and which one this is.
So this, I would just be doing chest compressions on the person that collapsed. This is actually the AED that I would be attaching to the patient or the person that collapsed, and then turning this on to defibrillate the patient.
I wonder, the CPR process, you have to be trained to do it. How difficult is it? How much, and we've seen it perhaps on TV, you're applying a lot of pressure to the chest. How much pressure are you applying to the chest when you're performing this?
We want to push fast and we want to push hard. And with the adults, we want to be at a depth of 2 inches. For a 2 inch push down into the chest.
What does that look like? Can you show us? So it's way down. So you're saying when you do CPR, don't be afraid if you're going all the way down.
Don't be. That's a good thing. Absolutely. We want to be at least 2 inches or 1/3 of the anterior posterior diameter of the patient, and we want to push fast and hard at a rate of 100 to 120 per minute.
So that means that's how many times.
That's how many times you're going to be.
Because that's how many times your heart beats regularly.
That's not not necessarily anywhere above 60 is normal heart rate. Everybody's different. Depending.
And you've seen when they push air down here. Is that part of the process as well?
For people that are not medical people, we just want to focus on chest compressions and early defibrillation.
So you mean for anyone else, and doctor, you would agree with that too, just knowing how to do these chest compressions is a key component, because there's a time limit when this happens to someone for you to do this and for them to get treated, for them to survive. Talk a little bit about that, doctor.
No, Andre, you're absolutely right, and I think I'm really glad you brought up the point about how far to push in. People are afraid to push in. I can tell you, as a heart surgeon at Alta Bates Summit Medical Center, the survivors that we've had have had rib fractures. That's how far you've got to push in. It's not uncommon to fracture the ribs or the breastbone. You really want to push in. The good thing is when you go to the Heart Association website and you get trained, the training mechanism will actually train you to know whether you're pushing in hard enough or not.
And I want to get to the defibrillator as well, Dana. Can you talk a bit about that? I remember when this first came out years ago, this was like, you don't have to know how to do CPR. You just, if you see someone, grab this. Tell us how that part works.
So with the AEDs, and they're all a little bit different, but you're going to open them up and you're going to put the pads on the patient, the person that collapsed, and then it's pretty simple because there's pictures on the pads. So like this is going to go right in the middle of the chest, and you can see the pictures here. I'm going to put that one here, and then this one would go here.
Just follow the pictures. One here, one here, one here.
Take these pads off, the stickers on the pads. Apply that. We want that, like I said, in the middle. That's going to give you your feedback.
And what is this? Why does this one go here?
You want to be across the heart. So
Gotcha.
it's
Okay.
sort of a bipolar, so one on each side of the heart, so
Gotcha.
the electricity goes across the
Kind of
heart.
like a battery almost.
Exactly.
So you put one
No,
here,
well,
one here.
This is a battery.
Yes,
You're exactly right.
All right. And so we were talking about the ease of use here. It's got the pictures. What else do you do after you put these on?
You're going to turn them on,
Yeah.
and then it's going to prompt you to what to do.
Yeah. So this is interesting. It's got pictures.
Okay.
And it has an audio prompt.
Touch patient.
It's telling me when,
Analyze it.
so I would tell everybody, step away from the patient, do not
Gotcha.
touch.
So that's what that's why this is so
Don't
important.
touch patient.
The simplicity
Analyze
of
it.
its use to keep someone alive for a lot longer, right, doctor?
It walks you through it.
Shock
You
advice.
don't have to be afraid of it. It will
Don't
not.
touch.
It won't shock the patient
Yeah.
unless the patient needs a shock. So you don't have to be afraid of using it. A
Gotcha.
number of times it's been applied in the field, like at the Oakland airport.
Yeah.
A shock was not given because it wasn't needed.
Gotcha. So the machine does the work itself, but if that's not around, you can go to the American Heart Association website and kind of and get the training that you need to do it, because it is really scary when this is happening in front of you. As I mentioned before, I've watched this happen. I didn't know CPR, and I didn't see a defibrillator there nearby. But you have both of these pretty simple options, I would say, to try and save a life, right?
Yeah, absolutely. The mantra is look, listen, and feel. So when you see a person down, you look, are they awake? Are they breathing? Listen for breaths. If not, you feel their carotid pulse.
Yeah.
And if not, start CPR right away.
You think the Demar Hamlin issue was something that thrusted this back into the spotlight? I assume this is exactly what you do. I'm sure you were looking at this like, just finally, people need to know how to do this, correct?
Exactly. And I think his good outcome showed the value. That trainer doing CPR right away kept his brain alive.
Yeah.
That's why he's alive today, because of early and good CPR.
Yeah, it can happen at any time, at any point as well. Dana, Dr. Khan, thank you so much for joining us today. We really appreciate it. Thank you for the demonstration. It is really life-saving to know these two tools. If you not have one, you have the other that you can do to save someone's life. Thank you both so much. Appreciate it. Following